Living longer and thriving in life is something that we can all rally behind. Fortunately, there is one thing that will help 90% of seniors live longer, guaranteed. It's so important to have a body that is resilient and strong. In order to achieve that, you need to take your muscle strength very seriously. What I want you to learn in this video is why being strong is important, what typically keeps aging adults from becoming strong, and how to gradually get yourself back into strengthening exercises without hurting yourself. Each year in our physical therapy clinics, we see thousands of patients over the age of 50. This is about the time when, due to a decrease in activity levels, your muscle mass and muscle strength start to lessen. We used to believe that this loss in muscle strength was due to natural physiological changes, but research has actually shown that age itself has nothing to do with it. The culprit is inactivity. This is the primary cause of aches and pains, decreased balance, and falls. Now, study after study is coming out, it seems like every month, that supports this claim. Plain and simple, these studies are showing that the more people participate in a moderate to heavy resistance training program, the longer they live and the greater their quality of life. Before you say, I don't need to strength train because I already walk, bike, swim, or do some other aerobic activity, think again. The research specifically shows that no matter how much aerobic exercise you do, strength training will still add years to your life. This doesn't mean that you should just ditch the aerobic exercise. It just means that if that is all that you do, you're missing out. So what constitutes strength training? In order to build any real strength, you need to be doing at least 60% of your 1 rep max. 1 rep max is something that is commonly understood and discussed in the weightlifting world. However, it's not so commonly addressed or understood to the general public. But it is exactly like it sounds. During a specific exercise, what is the absolute maximum resistance you could be able to do only 1 rep of? If you could do 2 reps, then it isn't your 1 rep max. Let me go on record by saying I don't want seniors going out and testing their 1 rep max. That's a good recipe for injury. So you're gonna have to guess a bit. Most of the time, if you're working at or above the 60% threshold, you'll really start to feel fatigue and feel like you can't do any more repetitions when it gets to around the 10 to 15 rep mark. As you go, over the course of a few weeks, you may want to work closer to the 80% of your 1 rep max level. In this case, after 8 reps or so, you should start to feel like you can't do any more and need to rest. We see people working out at the gym all the time who do 15 reps of an exercise, and it was so light that they probably could have done another 15 reps without even trying. That person is pretty much wasting their time. There's a study by Harvard Health citing 16 different published research articles suggesting that at least 60 minutes per week of strength training for people over the age of 65 results in a 10 to 17% increase in their lifespan. Just like I mentioned before, these articles specifically noted that only the people working out at 60% or more of their 1 rep max saw any benefits. There are many benefits of resistance training. The obvious one is strength, but there's also better bone density, improved balance, lower blood pressure, stronger cardiovascular health, better sleep, and less aches and pains. Strength training can also significantly improve your mental health and reduce the risk of depression. This may sound pretty straightforward, but the truth is, getting yourself back on track towards being stronger is not as easy as it sounds. By far, the number one concern we hear from our patients is the fear of them having increased pain and soreness. Or maybe they were told by another medical professional that because of some other conditions such as arthritis, spinal stenosis, or previous orthopedic surgery, that they should not do strength training. I want to be clear by saying that this advice is complete garbage. The only exception would be if you're rehabbing an injury and your doctor or physical therapist told you to follow a specific protocol with certain precautions during your recovery. Switching over to the topic of pain and soreness. It is temporary, not harmful, And it can be kept to a minimum if you progress your way into the routine gradually over a couple of weeks. But remember, if you can't tell that you worked out the following day or two and your muscles aren't sore at all, then you probably didn't push yourself hard enough to make any real physical change. Here is the exact way I explain it to our patients. When you're out of shape and you start trying to exercise, especially with resistance, your muscles may become a little sore. You will also be a little bit more tired than usual. This muscle soreness is completely normal and will lessen each time you exercise if you are gradually increasing your resistance and not overloading yourself in the beginning. For the first couple of weeks, the little voice in your head will start telling you,
"Come on, just take a day off. You're busy today. You deserve a day off. You need to let your muscles recover. Sit down, put those legs up."
don't listen. Stay consistent and do your workouts at least 3 times per week. And on the days you aren't doing strength training, go for a walk, a bike ride, or a swim. Something to keep your muscles moving and blood flowing. After a couple of weeks, the next few weeks won't be nearly as tough. That voice in your head will start saying,
"Okay, sure. Go ahead and work out. It isn't that bad."
you'll no longer have to give yourself the pep talk before, but it still may not be quite as easy to prioritize your busy schedule as you hope. Keep pushing yourself. Again, consistency is key. After about a month, you are now in a routine. You've made a habit out of working out. You're going to start feeling better, stronger, more confident, and stable. The little voice is now egging you on.
"Don't forget to train today. In fact, can we do it now? Can we? Can we?"
At this point, you just pulled a complete 180. You went from dreading the workout to craving it. I bet you'll even start craving healthier foods and making other subtle lifestyle changes that will help you live longer and thrive. Heck, I wouldn't even be surprised if you clicked on the subscribe button below and started going through some of our other great videos on this channel, like this one. Until next time.